Hello, my name is Lindsay Graham, and I lead our benefits and protection operations teams at Principal Financial Group. Probably like many of you, I've spent a few times out in the audience for GIA, but this is my first year having the pleasure of being a mentor. And I was lucky enough to get paired with Nicole T-Lott. She's the founder and CEO of AppEase. She was a previous life insurance agent, and she recognized an opportunity to improve the underwriting timeline and process. So Nicole and team, with that experience and her passion for innovation and a drive for excellence, Nicole and team are really modernizing the medical records retrieval process and improving insurance underwriting and claims processing. So please join me in giving Nicole a warm welcome.
Hello, I'm Nicole T-Lott. I'm the founder and CEO of AppEase, and I'm a financial advisor by profession. One day you come into my office and we determine that you need life insurance. We submit the application to the carrier, and you would think it would be a relatively simple process from there, right? That is what the consumer expects, but unfortunately, it can take weeks or months to get coverage. And that is because 1 in 4 cases actually require medical records in order to determine eligibility. And on average, it takes 29 days to get those records from your medical provider to the carrier. My personal longest case took 4 months to get. And as a financial advisor, I believe getting insurance should be easy. At AppEase, we have created a digital health data platform that quickly and easily exchanges medical information between your medical provider and insurance carriers for underwriting of life, disability, and long-term care applications and bodily injury claims processing. As I started exploring a solution to this problem, I surveyed 100 different agents and advisors across the industry, and I found that an astounding 83% had issues with record retrieval. 50% had lost cases due to retrieval taking too long, and 42% had actually recommended smaller policies in order to avoid the retrieval process altogether. That is a lose, lose, lose for the consumer, the agent, and the carrier. On top of attrition and smaller placement rates, our carrier partners also spend an average of 2 hours per day on the phone tracking down paper records. Underwriters spend 10 million hours per year reviewing outdated paper records, and there can be significant fines for lack of compliance. One provider experienced an $800,000 fine for improper disposal of paper records. And this just barely scratches the surface of the true financial magnitude of this problem. With 50% of the insurance workforce projected to retire in the next 4 years, we're only going to see this problem accelerate. So while we started in life, disability, and long-term care underwriting, we quickly realized that this was also a serious problem for claims, specifically bodily injury, and we are working with that market as well today. And we are positioned to expand into group coverage, health insurance, and to advance our data analytics solutions in the near future as well. So why is this such a big problem? On the next slide, you are going to see a real-life rendering of the current problem. As you can see, it's a mess. So when the carrier determines that they need your records, they outsource that request to third-party number 1. Third-party number 1 sends the request to your healthcare provider that holds your record. And the healthcare provider outsources record retrieval to third-party number 2. They gather the data, they send it back to third-party number 1, and eventually it gets back to the carrier for decision. Now, none of this really matters, except to understand that this is a clunky, time-consuming, and expensive process. And it's being done in really archaic methods of paper, snail mail, fax, PDFs, and we occasionally still see CDs. With AppEase, we have transformed this messy, archaic process into a streamlined digital solution where some of our data is actually available immediately via straight-through processing. And we know right away if the record will be available electronically or not, and if not, we can streamline the process into your existing workflow. AppEase does not require integration, which is great. But what we do is we connect directly into the electronic health records like Epic, Cerner, and Athena, and we gather and transfer this data via fully compliant processes. And we figured as long as we have the digital data, we should probably do something with it as well. And so it is deduplicated, it's searchable, it's sortable, it's summarized. And with our decision engine and predictive analytics model, it's actually designed to reduce review times by 50%. Our retrieval solution is 15 times faster than the current process. We have stabilized pricing at half of the cost, and we reduce the number of vendors required for the process. We take fragmented, disparate data, and we bring it all together into one place to enable underwriters and claims processors with fast, usable data. This is our founding team. Kylie Ortlieb is my co-founder and our CTO, and we believe that with 90% of health systems on electronic records today, bringing you data from cloud to carrier is the future of insurance, and it is here to stay. And our team, with our deep industry experience and personal motivations and passion for improving the industry, is committed to bringing this solution to you. We are excited to announce that our retrieval solution is complete and now available for market. And we have begun development of our analytics solution for life insurance underwriting. Today, we are inviting early adopters to consider piloting with us. And we are accepting 2 pilot partners that are either carriers or TPAs. And we would love the opportunity to serve with you. And as I wrap up today, gone are the days of reviewing hundreds of pages of PDFs and waiting weeks or even months for data to come in. At AppEase, we are empowering carriers with easy, fast, reliable health data so that we can improve insurance and make it more accessible for everyone. Thank you.